So real talk, let's talk about having a caregiver after surgery, because this is one of our requirements for our elective procedures in our surgery center. What is a caregiver? Well, a caregiver is typically going to be the person who's going to pick you up from surgery, but also going to be with you for the first 24 hours after surgery. So why do we care? Well, first and foremost, you just had anesthesia, which means that even when you leave our facility, although it is safe to send you home by our discharge criteria, you still have anesthesia in your system, which means that you still may have your memory impaired, your judgment impaired, your reflexes impaired. So it's really important that you have somebody to be with you until the anesthesia wears off. Another reason is safety at home, guys. There are going to be things that you just simply cannot do and you simply need help with. And oftentimes before a surgical procedure, it's really hard to anticipate all the things that you might need help with after you have that surgery. Then the last thing is, God forbid, if you guys have an emergency after surgery, right? Emergencies are really rare in kind of scheduled elective procedures, but it's surgery and things do happen. What if you pass out after surgery and you hit your head? What if you have a bleed after surgery and you need to meet me at the hospital because you need to get it taken care of? While we can't plan for every scenario, and while there's not a finite time period where risks can happen, and then after that time period, there's no risk factors, it's best to be prepared. At the end of the day, it's really about ensuring your safety, not only during the surgical procedure, but also afterwards. If you guys have any questions about plastic surgery, about caregivers and responsibilities, definitely drop them in the comments below. Give me a follow if you like my content, and see you next time.